Now, the country is paying for fictitious medical equipment supplies or equipment that are gathering dust in the counties owing to lack of supporting infrastructure. Details contained in a report published by the Institute of Economic Affairs shows several hospitals that received medical equipment have never utilized them 3 years since delivery. Sam Gituku reports of a program that could have wasted billions of public resources with nearly 3 more years to go.
So we should be able to
It's been a source of conflict between the national government and the counties since inception in 2015, when the national government negotiated a deal to lease assorted medical equipment for a period of 7 years at a cost of 38 billion shillings. That figure, according to the Institute of Economic Affairs, rose to 63 billion shillings with no appropriate explanation given. The program was to benefit 98 hospitals in the 47 counties. Details now emerging that not all may have been delivered and not all machines delivered are in use. In UASIN GISHU County, theatre equipment meant for Ziwa District Hospital had not been delivered by November 2018, 3 years into the program. The Ministry of Health is said to have claimed the equipment had been reallocated to the Moi Teaching and Referral Hospital, never to be found there. Radiology equipment meant for Burnt Forest Hospital was also not delivered, the report says, while theatre equipment for the same hospital was lacking a blood transfusion fridge necessary to attend to over 10,000 patients injured in traffic accidents and burns every year in the county. In NYAMIRA County, the annual cost of maintaining the equipment had been put at 95 million shillings in 2015. That figure, according to IEA, had risen to 200 million shillings per year by November 2018, with no corresponding explanation. In NANDI County, 390 million shillings had gone to maintaining the lease agreement, the IEA report claiming there had been no consultation with the county government and that the procurement was handled by the national government. This despite government insistence, thorough need assessment was conducted before deployment.
It was done competitively, as it were. It was demand-driven to the extent that the assessment had been done. And what was agreed at that point in time is that the government, national government through the National Treasury, was going to avail resources by way of a conditional grant to the counties.
Part of the equipment delivered in Nandi hospitals, the report says, had been idle as of 2018. They include C-arm necessary for X-ray services. X-ray equipment had not been connected to power as upgrading of power source was required. A power backup equipment was also idle as power source had not been upgraded.
The equipment which have been deployed and are functional in most of the facilities where they've been placed followed through consultations with the counties. Minutes, communique, agreements were entered into at 2 levels. One, the level of the ministry and the CECs responsible for health then, which followed the execution of a memorandum of understanding between the ministry and the counties, the governors themselves.
In West Pokot County, Kapenguria District Hospital had never used a renal machine delivered in 2015. The digital X-ray unit lacked power connection, while a CT scanner had not been delivered 3 years down the line, despite the county being charged for it. The IEA report, which also details a few cases of improved services since the arrival of the equipment, proposes special audits into the project, evaluation and reconfiguration of the same. The report warns some of the medical equipment lying idle to be redistributed to needy hospitals and transparency on the contracts signed by the government with the suppliers on behalf of the counties. Sam Gituku, TV.